One of the things that really particularly were difficult this week was we had 8 school health professionals out this week. They're also able to get this Omicron variant. We have shortages right now in our school health nursing department. We have 3 open positions. School nurses, we have 1 charge nurse that's open, and we have 4 school health assistants that are open, which has caused this to be more difficult on our health department in our schools. And of course, we'll talk about our own school data here in just a minute. Our health department is barely holding water in the school at this point. They are really overwhelmed. So what they're trying to dwell on is the positive cases to the best of their ability, try to get those students and staff home. The difficulty is their contact tracing, and it's just taking multiple days for them to be able to contact trace due to the abundance of new cases. What you guys understand, and I think probably everybody does at this point, but for every one positive in the school, there's a lot of work behind the scenes, talking to the teacher who they've been around for 15 minutes or more, then contacting those students, talking to them, contacting those parents. And in our case, currently we do have normal quote-unquote school, so the ability to be around each other is very likely. And so they have to not only monitor that from first period, second period, third period, fourth period, from high school, so you have to talk to all those teachers, and then in middle school they have a team of teachers, plus the special encore teachers, and then in elementary school it's a little better because they just have the encore teachers and then the people in the classroom. So that work behind the scenes is one of the reasons that our health department is really overwhelmed. And of course then too, with all the questions that are coming in, they just can't field them all. Also too, with the changing guidance, that threw another wrench into things when we came back. The CDC changed theirs, North Carolina changed theirs, and of course the Safer Schools document also changed, and now the nurses have had to change from that. On top of that, we are doing test to stay. Today I think we had over 300 students and staff in test to stay. So that gave them the opportunity to be in school, but when you do test to stay, that's 3 more tests with those children. We just got more tests in today. At many schools we ran out of rapid tests this week. And also what we were seeing is because we were one of the only shows in town that had tests, many doctors were out, other places were out. Whole families were trying to come in and get tested. Kids were trying to get tested. Staff families. And it just became overwhelming.